Yesterday I decided to spend my day exercise down in Windrush Square in Brixton, just down the road from here. It's a space that is named after the generation of people who came to this country from the Caribbean in the aftermath of the Second World War to help rebuild this country because of the ravages inflicted by the Second World War. My parents are part of that generation, and so I know from their experience that they weren't always treated with dignity and respect, and have a square named after them and a fantastic building like the Black Cultural Archives down there in Windrush Square, which recognises the contribution that they made. Instead, they were met when they first arrived with signs saying no blacks, no dogs, no Irish when they tried to find accommodation. They had to fight for their acceptance. And so it's an outrage, isn't it, that now, at a time when those who are still alive should be living out their final years with comfort, respect and security, they're still faced with a hostile environment. Those are the words, a hostile environment for foreign migrants, that the Home Secretary Theresa May used back in 2012 when she was deliberately trying to seek electoral advantage. And it was that which led to a situation where so many of the Windrush generation were denied benefits, denied pensions, denied even the right to remain in this country, despite everything that they gave to what was called the mother country. And so as I stood there yesterday afternoon, I wanted to remember that generation. But I was also thinking about all of the people who now are paying such a high price to keep us safe and secure in this time of crisis. It's been a privilege to stand alongside others every Thursday evening, applauding all of our key workers, not just from the National Health Service, but our shop workers keeping the supermarkets stacked, the transport workers keeping public transport going, the people who are keeping our streets clean. It's been a privilege to applaud all of those people. But it's also becoming increasingly clear, isn't it, that we're not all just simply in it together. Of course, Prince Charles and Boris Johnson can contract Covid-19, but they were diagnosed, weren't they, precisely because they come from rich and privileged backgrounds, and they've been nursed back to health precisely because they have access to the best possible healthcare. By contrast, those of us from Black, Asian and minority ethnic backgrounds are much more likely to become critically ill and to die as a result of Covid-19. That's not just the case here in Britain, but the early signs in America, in cities like New York, New Orleans, Detroit and Chicago, is that disproportionate numbers of people from Black, Asian and minority ethnic communities are getting ill. It's no coincidence that the first 10 doctors and 3 of the first 6 nurses to die here in Britain have been from minority ethnic backgrounds. No coincidence, because a huge proportion of the staff of the National Health Service, 1.2 million people work in the health service, 20% of them are Black, Asian or minority ethnic, and 44% of medical staff are from Black, Asian or minority ethnic backgrounds. And that's been the case ever since the National Health Service was first set up in 1948. People from all around the world built the National Health Service. Indeed, back in 1963, the then Health Minister was responsible for a scheme which recruited 18,000 doctors from India and Pakistan. That Health Minister was Enoch Powell, the same Enoch Powell who 5 years later, in 1968, delivered that rancid Rivers of Blood speech, a speech which sent shivers down the spines of everyone from Black and Asian and minority ethnic communities. The man who catapulted himself into the position of Britain's racist-in-chief. That was the health service then, that's the health service now, one that has been built by migrant workers. But it's also the case as well, more broadly, that we are much more likely to become critically ill and much more likely to die. One of the transport workers who died was a man called Emeka Iheanacho. He was just 36 years old, and he told his mother, that if he didn't go to work, he would have his pay cut. So he went to work, and of course he paid the ultimate price. Now, there's some suggestion that the reason why we're much more likely to become critically ill or to die is because we smoke too much weed, drink too much alcohol, that we have bad diets or underlying health conditions. Well, the real reason why we're much more likely to become critically ill and to die is because we are the victims of institutional racism.